A special edition of the Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. My first guest is a cosmetic dentist that is getting a lot of attention lately because of the results he's getting with his patients. If you are unhappy with your smile, my advice, stick around for the latest edition of the Wellness Hour.
The Wellness Hour, an in-depth discussion with today's top physicians and medical leaders. And now, your host, Randy Alvarez.
You're watching a special edition of the Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. My first guest is Dr. Mike Harrison. Dr. Harrison is the founder of Creedmoor Road General Dentistry. We've invited him on the program today to discuss what's new in cosmetic dentistry. Dr. Harrison, welcome to the program.
Well, thank you very much, Randy. I'm really glad to be here.
Now, before we get into today's topic, a lot of questions about veneers and things like that. Tell us about your practice.
Well, I've been in practice for about 34 years now. Doesn't seem that long, but
long time there.
Time goes by quick. Seen all kinds of types of advances in dentistry and all. We've recently actually built a new facility where we really think we have the state-of-the-art equipment now and technology to really change some lives for people.
Now, people don't like going to the dentist. We talked off camera. You said you just have this wonderful staff. Everybody likes your staff.
Oh, they're wonderful people. They're like family to me. And the first person you meet when you come in the door will have a bright smile. They're all really...
How important is that, by the way?
Well, it's really important in everybody's lives because it can change lives. Lives are contagious.
Okay.
I mean, smiles are contagious.
All right, that's fair.
The smiles, you know, it's your smile. I'm sitting here talking to you, and as you smile, it makes me feel better. That happens with everybody. It can change lives.
Okay, now you say a lot of people hide their smile because they're ashamed of it.
Well, absolutely. One remarkable thing is I'll be walking down the street, you know, and I'll see some beautiful lady walking down the street that has gorgeous earrings on, a nice bag, and hair done real nicely, and she's not smiling. You know, and I kind of wonder, why aren't you smiling? You know, that makes life a lot more fun.
A lot of people just don't like to show their smile.
They don't like to show it. Then I might see her open her mouth, and then I know why. But I go, you've got that nice Brighton bag on your arm. Why not fix your smile? It'll change your life.
You think people don't realize how important it is? We've talked a little bit. I mean, you're biased. You're a dentist.
Absolutely, yeah.
Why is it so important?
It can advance people in their careers. You know, recently I had a patient come in. He said, "I've got somebody just went to work for me. I just hired him. He's an engineer, but I made him promise that he'd get his teeth fixed, or else he couldn't keep the job."
Isn't that right?
So, I mean, in career advancement, it's amazing. In relationships, we'll have people come in, "Oh, I'm getting ready to get married. Can you fix my smile? I want my pictures to look good." You
Interesting.
know, some people, it might be a divorce, and all of a sudden they're going to go back in the dating scene. So they want to look their best, and those smiles will brighten up their lives as well as their face and their presentation to other people.
It's become mainstream nowadays, it seems.
Absolutely.
Getting a smile makeover, you know, words like that to describe it.
Oh, yeah. We can do smile makeovers in one day now with CEREC. You know,
that's a machine that does what?
It's a CAD/CAM machine, meaning camera and engineering milling machine that can actually make porcelain veneers, porcelain crowns in a few minutes.
Right there.
Right there while the patient waits. No temporaries. You don't have to come back a few weeks later and have things put in. If all of a sudden you come in, "Gee, I got a wedding next week, and I noticed I don't like my smile." Well, we can make it over in one day.
Okay.
Just in a matter of a few hours now. It's a phenomenal technology. Just incredible of what we can do with that this day and time.
Now, do you see yourself as an artist?
I do. That's kind of been one of my hobbies as a child and growing up. And I like art. We collect art. And I look at teeth, when I look at a smile, as art.
You say it changes people's lives.
Absolutely changes them. And I'm going to show you some cases today that will demonstrate that. And the first one's going to be Pam.
Okay.
Now, Pam is a beautiful person in her own right, but she came in and she went, "I don't like the color of my teeth. My teeth are yellow." And I'm going to show you how that can be changed. And so here we have a picture of Pam when she first came in. And then
very flat teeth, by the way.
Very flat teeth.
How does that happen? Genetic?
Genetic, wear,
an
improper bite. In her case, she had a lot of old fillings, bonding, some of the original type of cosmetic approaches we try to do by sticking plastic materials on teeth to make them look better. And in her case, they started breaking down from chewing and wear and just picking up stain and turning the teeth yellow. They'll actually yellow after a period of time. So her teeth look yellow to her. She wanted them brightened. She wanted me to actually bleach her teeth. you know.
Right.
And I said, it's not going to work in your case because we can't change the color of the restorations on there.
So, okay, so in her case, whitening didn't work alone.
Absolutely not.
Okay.
Would not work alone. Now, you could whiten some of the teeth to give it a little lighter color, but not all of them, so obviously things wouldn't match. So what we had to look at is that envelope of her smile. And I call it an envelope or a rectangle, corner to corner. What do the teeth look like and how can we change it? How can we help this person? So we start through that planning process. But a lot of what we do first, we want to listen to them.
So how many veneers for her?
For her, we did 6. Just from corner of the mouth to corner of the mouth. In her smile, we looked at her smile, how many teeth would show. Just mainly her upper teeth. Lower teeth didn't show that much. We could whiten them a little bit. She didn't have a lot of restorative things on those teeth. No bondings to discolor. So we're just able to go in and put some veneers on her upper 6 front teeth.
Let's take a look.
Here
Huge difference.
Here it is.
Yeah.
This woman is absolutely gorgeous.
Yeah.
Just gorgeous.
Pretty.
Brightens up her whole face.
It really does. It makes a difference.
Doesn't it? And notice
she
how...
looks younger.
Oh, absolutely. And then how the teeth follow, the edges of the teeth follow the smile
now those
line.
Are real.
Her
those
lip.
Aren't big and bulky.
No, they're not big and bulky.
Very nice. Very
they're textured
smile.
nicely. They have translucency in them, so they don't look like chiclets. They look like real teeth.
What are the age ranges of these patients that are coming in? Are they getting younger? Are they getting older?
I have patients that are teenagers. I have patients that are 65 years old doing it. There's no definite age range. You can do it for anybody. A lot of people, they may be in their 60s, go, I have always wanted a beautiful smile. You know, now I'm going to do it. You know, I've got my kids through college. You know, I've got some money. So, hey, I want to go ahead and have a beautiful smile. Can you do that for me?
What happens on day 1?
Day 1, first of all, the patient comes in, and we want to be sure and do a complete medical exam.
Okay.
We want to do a real comprehensive exam of the mouth. We look at the chewing system as being made up of teeth, muscles, and joints. Okay. And we want those systems working in harmony because the teeth are actually the weakest part of the system. So we do the thorough exam. We take photographs. That's where we're going to get most of our information about their smile. Because in some of the photographs, it's hard to get them to smile.
Yeah.
You know, some people just don't smile because it's been so long that they felt their teeth look bad. So I'll take photograph after smile, 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 do something,
right.
smile.
Okay, interesting.
And then we'll take study models, which is probably one of the most important steps in the sense we can take the study models, show the patient with their photographs actually what their teeth look like, the arrangement of their teeth. And then we can take those models and actually wax in shapes for the teeth.
So you show them pictures, like sample smiles?
We've got a catalog, and
okay.
It's a 3-step process that we go through. And in the 3-step process, they'll pick out the type of smile they want. The first step is picking out the corner tooth in their mouth, the cuspid, if it's pointed, rounded. Then
some people want the pointy?
Some people want the pointed. And some people do not want the pointed. They'd go crazy if they had a pointed tooth in their mouth.
Interesting. So that's all designed on day 1?
All day 1. And also I look at the face. A person with more of a round face needs more of a rounded cornered tooth.
Interesting.
Somebody who has a square, strong jaw needs more of a square tooth. Somebody who has a long tapering face needs a tooth that's a combination of all. Yet in this process of the catalog, they can pick out their shapes. They could have front teeth that are rounded a little bit, square a little bit. Next teeth, they may want rounded more.
So
sure.
You pick the smile. They say, okay,
right.
I love this smile.
Oh, yeah.
You do some kind of a model
right.
of those teeth. Then what?
Then we'll do a wax up using the data they've given us of how we think the teeth ought to look. Then from that,
so they look at it outside of their mouth.
Looking at it right here in 3 dimensions.
Okay.
That's the problem with most of us. We only can see things in 2 dimensions. But here they can look at it in 3 dimensions. They can play with it. They can hold it. They can take it home if they want to.
Okay.
And look at it and spend some time with it, and then come back and say, "Hey, here's what I want."
Right.
But that's why we want as much information as we can get from them because we want that smile.
Okay. So they say, "I love it."
They say, "I love it." We're ready to go then. We'll actually before they even come in for preparation of the teeth on the day we're going to start the process, we can actually make them a temporary restoration, whether it's a bridge, veneer, crown, or what, before they ever come in. And we do that from that wax up. We copy that wax up. And then after we have taken our impressions...
So they try them in their mouth? We
try them in the mouth, place them in the mouth. We have them go through the 50s, talking, see what sounds are made. We watch to see if the teeth are touching the lip. We're seeing if they're having any problem pronouncing other letters or words. We have them go through several different sequences of numbers and talk. We let them look with a mirror why they have these provisionals in.
Interesting.
So that they can
So
say...
it's not just you saying this is what we
no.
need to do.
No,
Interesting.
no,
So they're
no.
part of it.
That's the big mistake, is if I try to dictate what's done.
Does that happen?
I don't try to. It
I mean,
happens
with
to other
dentists?
people, yeah.
Okay, now I know you did not want to say anything negative about other dentists, but nationwide,
no,
if there's a mistake in the world of cosmetic dentistry, what is it? As you see it. I mean, you've been doing this a long time.
I think it's failure to have the teeth done in a way that's predictable as far as the result, and they're not durable.
You think there's
They're
a lot
not
of cookie cutter
functional.
things going on out there? Because I see these straight across teeth.
I think they take an impression, send it to the lab, they get back, whatever they get, they put it in the mouth and tell the patient that's it.
So what did
That's what patients tell me that come in that want things redone.
Then what should somebody look for then in a cosmetic dentist?
First of
What
all,
do they ask?
somebody that'll listen to them.
Okay.
Somebody that's willing to sit there and listen to their needs and desires. Somebody that's not just going to put them in a chair and start preparing teeth and putting things in their mouths and say, come back next week, we'll have the crowns ready for you.
Okay.
Somebody that's going to take some time with
What
them.
about their work? And I've looked at cosmetic cases. These are some of the best I've seen. And I'm
thank
not
you. I
trying to
appreciate
endorse you on this program.
Well, I appreciate
But
that.
the work. Do they say, let me see your work?
Some will say, well, I read your bio. You know, I've checked things out. Most all of my patients are referred from other patients.
But do you recommend that if somebody's picking a cosmetic dentist to ask, let me see your before
Oh,
and after?
absolutely. They should ask, is what I tell patients, ask all the questions you want to. In fact, I tell them to ask my staff, because I tell them my staff are just as educated about this as I am.
Right.
Ask them. They've been through the process, many of them and stuff, if they have, especially if they have things they're concerned about. And also, we keep a portfolio on the computer of cases we've done so they can actually see what we've done.
Let's take a quick break. We're going to come back and we're going to look at these photos. Some dramatic photos coming up. You don't want to turn the channel at this moment. You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. We are here with Dr. Harrison. We'll be right back. You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, what's new in cosmetic dentistry? We have the cosmetic dentist that everybody seems to be talking about in North Carolina because of the results he's getting with his patients. Let's talk about some of these photos. You say it changes their self-esteem, that people actually act differently
Yes.
after they've had their teeth done.
Absolutely. You know, people can come in and never smile. After we do some smile makeovers, they come in and they'll stand around and talk at the front desk before they leave. I mean, and they're smiling the whole time. It's amazing.
Now, when they see their teeth for the first time, is that an emotional time?
Extremely. For both of us. For the patient and for myself, too.
Okay. What do they say? What do they say?
I can't believe you did this. I can't believe I look like that. This is incredible. In fact, the next case I'm going to show you, Myra, who's just a wonderful, wonderful person, probably one of the most enjoyable cases I've ever done. She was in just a few months ago with her preventive appointment, and she made the comment to me how much more time she takes taking care of her teeth. It changes that way. And her smile, when I first took her pictures, I could hardly get her to smile.
So this woman right here.
Yes.
Okay. Wow, what was going on there?
Well, for years she just had patchwork dentistry done, and by that I mean she had just fillings placed when she'd have a little problem, maybe a tooth would chip or break, so she'd have a little bonding material put there, or she'd have a little area decay or something. She just
It's like
had
an
a little-
old-looking smile, by the way. too.
Absolutely, absolutely. If you didn't see her face with the smile, you'd think it was somebody that was 60 years old if you looked at the teeth, because they're stained and they're out of proportion.
So what were her options? I mean, when you look at her, you listen to what's bothering her. Veneers. So what'd you do for her?
With her, we did veneers and what I call partial crowns, and veneers can be done.
A crown, by the way. Now, I haven't had dental work done, really.
Okay.
Crown is the thing that goes
Full
on top of
coverage, covers the whole tooth.
that. Okay.
Right. A veneer covers the front of the tooth, or a veneer can wrap around the sides of a tooth, but it doesn't cover the whole
So a crown
tooth.
is a porcelain that goes over the tooth.
A porcelain covers it all, just like you put a cap on something.
Got it. Okay.
Okay. In fact, that's the lay term you hear. I had caps put on my
Right.
teeth. That's what it is. In her case, because of the old restoration she's had and what we were trying to accomplish, and to prevent some overlapping, we had to reduce more tooth structure than a typical thin veneer. So we wanted to wrap it around the sides of the tooth. So it's what I call a three-quarter crown, or a wrap veneer that goes around the sides of the tooth. And that way you don't see staining between the teeth. We're able to make them more proportional by reducing one more than the other. So we widen one tooth, make another one a little bit narrower, and that way we can proportion her smile.
She looks great on the after.
Oh, she's wonderful. And she had about 18 teeth done with uppers and lowers, and the color is just marvelous. The translucency.
Without sounding superficial, I mean, she's much prettier in the after just because of her teeth.
Well, I think she was pretty to begin
Looks
with.
like she had something done almost.
But she's just a different person now to me. Just
Yeah.
gorgeous.
Yeah,
Just
that's a pretty
gorgeous.
smile.
Yeah. Let me show you another one. Okay, CJ came in and she wanted her smile to look brighter. She wanted her teeth to look whiter because they're dark along the gum line. So she was a perfect case for veneers.
So some people, whitening just doesn't work. I've heard that.
Does not work. The teeth are too dark. We just won't do it. So you have to do something else instead. Veneers are a wonderful way to solve that problem. Look at her. We went from these dark teeth to these beautiful, bright smile that just follows her lip line very nicely.
Very nice. People
Gorgeous.
treat her differently now, by the way?
Oh, I would think so. I would think they definitely do. I mean, just look at her smile afterwards.
She seems like a happy person
Very happy.
to begin with, but
I
mean, they smile more now.
I think absolutely.
Do they show it off?
I think it liberates them. I think when they go to a party, they're going to be smiling at the party
Okay.
as opposed to standing in the corner. And I'm not saying that she's standing in the corner.
What about pain? Somebody watching this, because we don't like to go to the dentist because it hurts.
Right.
Do they complain about pain?
No, not at all.
No.
No. And we've got technology that we use now, so I feel like we can make a patient totally comfortable and go through this, and they're very relaxed.
We can give them gas or something.
We can use nitrous oxide. We can give them a little pre-medication to relax them, but a lot of it's just caring about
I mean, literally, somebody watching this, bad smile, couple of trips, I guess in a perfect situation, couple of trips,
right.
And they've got great teeth.
Absolutely.
30 days from today.
Yes.
And what's the process? It takes a couple weeks to get the...
Yeah, you know, once you gather the information and you know what you're going to do, basically once we have put the temporaries in, about 3 weeks, and the permanent ones are in. So you can do the whole process in a month, or you can do CERAC, like I've said before. You can do it in 1 day.
Okay, CERAC is in your office. It makes the veneer right there.
Right there while they're waiting.
Okay. Not everybody is this common in dentistry?
No, only about 5% of dentists have a CERAC.
So it's a machine that makes the tooth.
It's a CAD/CAM machine that'll actually make the tooth, whether it's a veneer, whether it's a crown. It's phenomenal.
Well, you just load the information about their teeth into it?
We actually take a picture of their tooth with a camera that goes in their mouth. It goes in the computer. We design the restoration, whether it's a veneer or it may be a back tooth. It may be to replace an old silver filling where somebody opens their mouth and all these things look ugly, and they want to smile more. But made right there while they're waiting.
We have time for a few more.
This is Patty. Patty came from Florida. She's a hairdresser. She didn't like to smile, mainly wanted some shapes of her teeth changed in color. Not a lot to do, but had a lot of previous dental work in her mouth. Gums were gray, didn't want the gums showing anymore, and we could solve that problem with the all porcelain veneers and all porcelain crowns so that the tissue would look pretty around it. And she has a great smile now.
It's great.
It's wonderful.
Looks good.
Wonderful. Now here's Laura. I love this patient. I love the result we got and how happy she was with it. In fact, all she did was keep taking her mirror out of her billfold, looking at her, smile, and laughing.
She has a pretty good smile, though, to begin with. What does she say when she comes into you?
Her teeth were chipped. They're uneven. They'd worn so much in some places.
That front tooth is a little chipped.
Yeah, the two front teeth. And that's kind of in her case, that's the character of her smile, her two front teeth.
That's dead center, right?
Yeah, and you didn't want to make them smaller, because that's the center of her smile. But they were yellow, they were chipped, uneven, and she wanted it prettier. And up in the corner of her mouth, over on her left side, she had a crown with a gold band around it. That would show, and she wanted to do something about that. So we did the crowns, and we went and did a CERAC actually on that crown. An hour and a half, we took that crown out, got rid of it.
That's a beautiful smile.
Right. You don't see that gold showing anymore, that silver, shiny crown.
See, I always worry that if you do something on the front, you're going to get that gray line or it's a dead giveaway. I mean, this looks good.
And the reason is, if you did a traditional old type of crown or restoration that has a metal core underneath, light's not reflected through it. All porcelain, light's reflected to the porcelain and actually down the tooth. That's what happens naturally with natural teeth.
Now, she looks like a professional businesswoman.
She is.
Okay.
Yeah. Just a joy to work with. An eye personality. She's always looking for the next party. This is Will. I like this case because it shows that cosmetics can just be one simple thing to change a whole smile.
So more and more males are coming in, by the way?
Yes.
Because we definitely don't like to go to the dentist.
Right. But usually the wife has told him to go in.
All right.
That's typical.
Okay.
But in his case, two front teeth. Had old bonding, space between the teeth.
Completely flat.
Flat,
on those
worn
befores.
off and everything.
Is that just from chewing? Wear?
From grinding, from wear, from chewing. Absolutely. Yeah.
Yeah, not a good look there.
And so his bondings wouldn't stay on. Because of his grinding and clenching of his teeth, he'd pop them off. So we went in, put some porcelain veneers, and just gorgeous.
But won't they just pop off again? I mean,
No.
for the same reason it happened the first time?
This day and time, with the bonding materials we have, they will stay on. In fact, the only way I can get those off usually, I've got to grind them off if somebody has a problem or I'm taking one out for some reason.
That's a good-looking smile.
Great smile. Great guy, great smile.
Was he very self-conscious before, by the way? Didn't like the smile?
Did not. He did not like the space showing between his teeth. He did not like the fact that it was chipping out. So,
okay,
but now he smiles all the time. He's a joy to see in the office.
What about younger patients?
Younger people have a classic problem that cosmetics is really helping with called peg laterals, or their teeth that haven't developed fully. So right in the front of their smile, they'll have a little tooth here that looks like a peg.
Oh, is that right?
And they're going through their teenage years where it's so important, and they don't want to smile because that peg's going to show. Who's going to ask me to the prom if my peg is showing?
It's common, huh?
It is common. It is common. We see it frequently. So now we can go in and change that smile with CERAC in a matter of a couple of hours. You know, we have this beautiful, beautiful girl, Megan. She's been a patient for a lot of years.
I see that little tooth.
Little tooth. You know, 2 hours later, she wanted something done for that tooth as well as the one on the other side. So we did 2 teeth because she wanted to balance her smile more. So we did it with the CERAC porcelain. Matched
Pretty
it.
smile.
Pretty smile, pretty girl, and really likes to smile now.
Okay, okay.
She's just a gorgeous lady.
We have time for a few more.
A few more. Let's take a look here at Nikki then. Nikki didn't like her smile at all, and I can certainly tell why. If you see this one tooth on here,
a lot of gray around the tips.
Gray around the tooth, and the tooth sticking down farther than all that. It's a crown. It's sticking down, hitting her lip before the other teeth
Looks like
do.
a bridge. So that's just
a
bad crown.
That's a bad crown. Showing that's
a lot of
bad
that.
crown.
Okay.
And I don't have an explanation of why somebody would walk out of somebody's office and allow that to be done, or why some dentist would do it, tell you the truth.
Okay.
There's just no reason for that.
Okay.
So we went in 5 hours later, we redid her 4 front teeth, and here she is. She's got this gorgeous smile, beautiful porcelain.
Very young-looking smile.
Absolutely young-looking smile. And a wonderful, wonderful person. This next case is Joy, who really is a joy. You know, her name fits her personality, and later in life, she's decided, I want to change the color of my teeth. That was her chief complaint. I want teeth that aren't. I want to change them a little bit, but I don't want to change the color so they don't look natural. I want them kind of like the same color of my lower teeth, but my upper teeth are worn, they're chipped,
Interesting.
they're broken.
It seems like everybody would just want really white teeth.
She didn't want really white teeth. She didn't want perfectly shaped teeth. She just wanted teeth that looked better and not raggedy and broken and old fillings showing.
Okay, they were pretty bad. I mean, pretty
colors.
flat.
They were real bad. A lot of wear. A lot of years, a lot of wear. Old fillings chipping out, you know, things happening. 5 hours later, we've done 6 teeth across the front, and she's got this gorgeous smile.
Nice
and
shape to those teeth.
Look at the color match, too.
Yeah.
We didn't even do the lower. And that was done in the office.
And they don't look like dentures. I think when I see a 50-plus woman with these white teeth, now that I interview dentists here and there, I always think it's dentures. And this is a very authentic look. Very nice.
Well, thank you. Thank you. We're real proud of that, and she loved it. She was really fun to work with. We enjoyed that.
So matching the teeth.
Right.
You have an instrument to match the teeth. Tell me about that.
Well, what we use currently is called Easy Shade. And it's actually a computerized system that we can actually touch to a tooth, and it will register what color that tooth is. Let's say if we're trying to match one tooth to another tooth, then we can register it. Or if we want to make a tooth really look real and we want to put several colors in, we can pick out several colors in a tooth and make as many as we want to in a tooth to give it more of a natural look. Why is that so
important, by the way? Because it seems like if they're going to you, they don't like the color of their tooth to begin with. So why do you want to match that tooth?
It just may be 1 or 2 teeth that they're trying to match. That we're trying to match. And so we want to pick out all the different colors in those teeth. So
so this is a case where one tooth needs to be done.
Right. And we don't want it to stand out. You know, that's the person walking down the street that you see.
I see one great tooth.
Exactly.
So you have to match it. Interesting.
Right. And we can also take it, and after we make a restoration, we can take the instrument, shine it on the tooth, and see if the porcelains came out like we wanted.
Now, in that photo, who is that woman?
Oh,
She works with you?
Oh, yes. This is what makes my day brighter.
Okay.
Her smile would brighten anybody's day up. She's worked for me for 11 years.
Is that right?
I don't know if I could survive without her.
What did you do to her smile?
We did a little Invisalign, actually. Not much.
And
that's pretty much and a little whitening. That's pretty much her natural smile, though.
And what is her role in the office?
She is my one of my chairside assistants.
Okay.
I'm kind of my treatment coordinator.
All right.
Just a joy to be around. And that's when I talk about smiles are contagious. I have never seen her not smile. She brightens up my day so much, it's incredible.
So they're friendly people.
friendly people, just like at my front desk with Wanda, the person you would meet when you first come in.
Now, all these people have great teeth. I guess that's the nice thing about working with a dentist.
Well, yeah, and if they don't have great teeth, we can make them have great teeth.
All right, all right. So who is this?
Wanda is actually the person that greets you when you come in the office. She used to be a patient for years.
Okay.
And she had this great smile and personality, and I used to say, I wish she worked for us. That's who I would love to have at the front desk. One day she asked about the job, and I said, doesn't even have to ask about the salary. She's hired. No interview. She's here.
Right. Now, we are completely out of time. Okay. Final message. Somebody watching this, they're not happy with their smile for whatever reason, and but they can't get themselves to do something about it. What do you say to them to lower their fears?
There's never anything wrong with coming in and gathering information, finding out what can be done, how it can be done. Voice your fears. You know,
what do they tell you on a consult? What are they afraid of most?
They're mostly afraid of it not looking good. And some people are afraid of pain and discomfort. You know, actually.
You always meet with them?
Always.
You do all your consults?
I do them all at a table in a nice, relaxing room. Talk to them first before anything's ever done in the office, because I want to listen to them and find out what their needs and concerns are. Because these are people. We care about these people, and we want to address their needs. I don't want somebody walking out of my office unhappy with their smile.
So they should give you a call.
They should give me a call. Most important contact is the call, and their answers can be addressed there. We welcome them in just to take a tour of the office.
So they're
not obligated for anything.
So they should get an opinion then about
Absolutely.
What's possible.
Absolutely.
And it's not all just about veneers in your office.
Absolutely not. It's all about health.
Okay.
It's about health.
All right. I want to thank you for coming on the show. Very interesting.
Well, thank you.
Beautiful before and after.
Well, thank you very much. We appreciate it, Randy. Thank you.
You've been watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. If you would like to see this again, this interview online, visit our website at wellnesshour.com. For now, I wish you good health.